Hi everybody, this is for a friend who's having redness after using his new glaucoma drops, and the reason for that is probably an allergy to the actual medication and preservative. So I want to just show you what these brand names, Lumigan, this is a latanoprost generic, is also available. This is Simbrenza, which is a 2-in-1 drop. For glaucoma, it's basically brinzolamide and bromonidine. It has a preservative, and it has basically all of them pretty much have BAK, benzoyl conium chloride, which a lot of people are very allergic to or have redness. And so the kind of prostaglandin analogs basically are trying to help improve the fluid out of the eye, but you use it at nighttime so you don't notice the redness. So you can put it in the refrigerator, or you can put it on an ice pack, like in a thermos near your bed before you use it. The cold will try to blanch the blood vessel so it's not so red, but some people still can't tolerate any of these. This is Alphagan, for instance, which is bromonidine generic. There is now some preservative-free options, which I have here. Actually, one more, Combigan. Same kind of idea. So there's different types of drops, but they all have preservatives. The ones that don't have preservatives we could try, but a lot of insurances don't cover it, and they can be super pricey. I'm talking about like $800 a month, sometimes a little bit less. So we can try that. If that doesn't help, then we will do a procedure called selective laser trabeculoplasty, which is very safe. It's covered by insurance majority of cases. Some insurances require us to fail a glaucoma drop, meaning you've tried it, but you were allergic or it didn't work. And basically selective laser trabeculoplasty, for those that don't know, is basically the cornea looks like this. The iris is the colored part of the eye, and there is a drain that goes all the way around where basically that cornea, the clear window of the eye, meets your sclera. There's a little drain there, and it's called the angle, and the angle kind of is, this is your cornea, this is your iris. It's right here, and the cornea goes like this, right? So we make these little holes all the way around to open the drain, just like the sink of your kitchen gets clogged. Sometimes this unclogs it. The risks of the laser are very rare. I've never seen a complication. The biggest risk is it's not a cure, of course. It's just to open that drain, and it lasts sometimes for about 6 months. It's not forever, but it does work. And so it's something to consider if you're allergic to the drops. The other thing you could do is use cold artificial tears that are non-preserved. Like there's hundreds of these. Here are some examples we have in the office today. These have no preservatives, so you put them in the refrigerator, and again, the cold is going to blanch the blood vessels. So I'll tell patients, wash your face with warm water if you can, if you don't have ocular rosacea or you're not sensitive to heat, because heat opens the pores of the glands, and so we do heat, ideally 15 minutes twice a day, blink, 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 keep that oil pumping. So it helps kind of keep the eye lubricated, but some people can't do heat because it makes their eyes so red, because heat can increase inflammation. If you can't do heat, then we just do cold compresses just to decrease inflammation, but ideally heat 15 minutes twice a day, massage, push that oil out, just keep that oil pumping, because all these chemicals with preservatives hurt the glands that produce the tear. So that's kind of an issue long-term for a lot of our patients. So after the heat, if your eye is very red, then we put cold compresses after to decrease inflammation. So we're doing both for different reasons, but it does work. If you can't do any heat, then we just stick with cold. And then often if the drops are just not working, then we have to switch you to a different drop, or we can't use any preservatives. We switch to a non-preserved drop and see if your insurance covers it. And if it doesn't, or it doesn't help or doesn't work, the pressure doesn't come down to the T goal, which is about 20 to 30% off the T max, the highest eye pressure, versus the goal pressure of your eye, to basically stabilize the pressure of the optic nerve, then we talk about procedures like the selective laser trabeculoplasty. Anyway, I hope this helps. Have a great day. Bye-bye.